Hi and welcome back, and today I'm answering an important question, which is, can you survive sepsis? Yes, you can survive sepsis, which is also known as septicemia. And how do I know that? Well, the reason I know that is because I've been fortunate enough to survive sepsis 3 times. But that's not to underestimate the condition or the infection, because sepsis is considered a serious medical emergency. What are the early symptoms of sepsis? Well, for me, I got a fever, so my body temperature went up, but at the same time I had chills, so I felt cold. It's a little bit like having flu, where you're shivery but you've got a fever. The other symptoms include an increased heart rate, you might feel clammy, you look a bit pale, which is all the early symptoms that I had too. Who can get sepsis? Well, one of the categories of people that can get sepsis is if you have a suppressed immune system. And this can result from going through cancer treatment, for example, which is what I was doing. I had non-Hodgkin's lymphoma, and I was having chemotherapy, and that destroys your immune system. And that makes you susceptible to sepsis, which is what caused mine. Also, young babies under 1 are more susceptible to sepsis. Pregnant mothers that have just given birth can develop sepsis. If you've just had an operation, open wounds and things like that can lead to sepsis. Elderly people, some people say over 65 and some people say over 75. If you have diabetes or if you're overweight, you're in a higher risk category of developing sepsis. What is sepsis or septicemia? Well, sepsis is actually poisoning of the blood or blood poisoning, and that poisoning is caused by bacteria. What is the difference between sepsis and septic shock? Sepsis can lead on to septic shock, and this is when your blood pressure starts to drop and you start to get organ failure and your organs can actually close down. And quite worryingly, 30% of people who have severe sepsis and 50% of those who get septic shock actually die in a hospital. So sepsis and septic shock is not to be underestimated. And I feel very fortunate I managed to survive sepsis 3 times. How long can you survive with sepsis? Well, importantly, you can die within 12 hours of developing sepsis. So early diagnosis and early treatment is key. Now, one of the things is, even though I was going through cancer treatment and even though there was a known risk of getting sepsis, I was ignoring the symptoms of what I was developing, because I didn't realize the risks of sepsis. I didn't really actually understand what it was, and not many people do. If it wasn't for my wife pushing me and making me go to the hospital because she could see how ill I was and what I looked like, and because of the high temperature I had, then I probably wouldn't be here telling the tale and talking about sepsis now. So I urge you that if you know anyone with any of the symptoms of sepsis, or if it's yourself that may be having symptoms that could be sepsis, make sure you get it diagnosed and get treatment straight away. Can sepsis be cured with antibiotics? Yes, it can, because what used to happen to me each time I had sepsis, I would go into hospital, I would have an intravenous drip put into my veins to hydrate me, and that intravenous drip contained antibiotics. One time I was in the resuscitation department and I actually had 2 cannulas, 1 in each arm, and that's how they treat sepsis. And a hospital's aim is to get you onto an intravenous drip within an hour of being admitted to hospital. Can you have any lasting conditions as a result of having sepsis? Yes, you can. I'm fortunate that I don't have any lasting conditions having gone through sepsis, and this is possibly because I didn't go into septic shock. But you can end up having limbs removed, you can have damage to organs, and because of the trauma that you go through when you go through sepsis, and particularly if you end up in septic shock, and fortunately, if you can survive that, sometimes people end up with post-traumatic stress disorder. They have flashbacks, and you may be left with lasting damage. Now, I've been fortunate because that didn't happen to me. What do I do differently to prevent getting sepsis again? I'm fortunate that I survived going through cancer. My immune system has recovered, so I'm no longer at risk as a result of a depressed immune system from getting sepsis. However, I've just passed a milestone, so I've just passed the big 6-0. So I'm getting older, and as I get older, my risk of getting sepsis increases. So I'm making sure that that doesn't happen to me by making sure that I'm not overweight. I eat a healthy diet. I also exercise. And one thing that I am doing is I'm doing intermittent fasting. And intermittent fasting has many, many health benefits. It helps to reverse or slow down aging. It helps you to lose weight. It can also reverse and improve symptoms of insulin resistance and type 2 diabetes. So if you have type 2 diabetes, you have a higher risk of sepsis, so you may want to consider doing intermittent fasting. But you should also consult a doctor, because I'm not a doctor, I'm just a guy on the internet, and you should consult them before you perhaps start doing intermittent fasting, and just ask them about what your risks are of developing sepsis. And if you have any of the symptoms like a fever, a high body temperature, you start to feel clammy, you start to feel confused, or have any of those types of symptoms, you should consult a doctor. And if it's really serious, dial 999 and go to the hospital. My final message to you is to not ignore the signs of sepsis, which is what I did in the early stages, and which is why I ended up in the resuscitation department at Bournemouth Hospital. Take care, have a good week, and bye for now.